Doc Griggs, we are live on YouTube right now. Doc Griggs. Doc Griggs.
Hey, I'm here.
We are live on YouTube.
Well, hello, YouTube. Glad to be alive and on YouTube.
Hello?
Can you hear me?
I can hear you. So we are live. I already pushed it to Facebook. Did you?
I got your tag, and we can rock and roll.
All right, you're coming in kind of spotty and your video stopped.
Yeah, I'm not sure. Let me, I'll switch to a hotspot.
You don't have Wi-Fi at the house?
Yeah, it's called Dairy Fi.
Yeah, remember he's always said that his hotspot is better than his Wi-Fi?
Yeah.
Who is that? I didn't hear it. What happened?
I got Chris on the phone.
What's happening, Chris?
I'm just reminding him of old information.
Hey, handsome. You want to come up? Let me know when you're ready.
Ready to roll. Let's go.
Not a puppy, but all right.
I'm on call Shearer. Yeah, Shearer.
All right. This is
Okay.
Chris. Eric, you ready?
Yeah, let's do it.
All right, cool. All right, welcome to our COVID daily live show with Doc Griggs and Dr. Derry. Thank you for tuning in on YouTube as we are still navigating our technology options here. Everybody say hi to Handsome. Handsome, say hi to the internet world. Handsome is one of many cats making Zoom posters.
Handsome is our IT guy.
Handsome's the ITS. Handsome was found during Katrina, which makes her 15 years old.
Wow.
Almost 15 years old, and you can see she's starting to age a little bit. And she's no longer the little kitten that she was. She was a kitten until she was 14, and then she kind of aged all of a sudden.
Huh.
So, anyway, so how are you doing, Doc Griggs? We missed
Hey,
you.
man, just COVIDing. I'm very COVID.
You're very COVID.
Yeah, not sick, but very COVID.
How's your day today?
Good. It's just I don't even know what day it is, but it's weird. I think it's a day that ends in Y. We're getting through.
When we're done with this, remember everybody, we do have a podcast we'd love everybody to subscribe to. It's called NOISEFILTER. We record it as soon as this is over. So you come into the shop as soon as we're done here?
What happened? Are you at the CAC?
No. I'm headed to the CAC when I'm done.
Yeah.
You're gonna come join us there?
Yeah, I'll see you there.
All right, cool. NOISEFILTER is a daily podcast that Doc Griggs and I, we go over 3 or 4 hot topic. Hang on a second. Wait a second, hang on. I think they were supposed to do a conference call. Hang on a second. Go ahead, Griggs. Talk about what we went over today on the show with Grayland.
Ooh, we had quite a few things going on. The big thing was the reopening. We talked about the fact that the tug of war, the push and pull of whether or not we should open. The fact that if we open without putting public health, without putting public health first, would have a cost, and it would be a cost. The cost would be human lives. There is an issue that was heard from it was from Texas, from leadership in Texas, that this was a known consequence. That history actually shows. I mean, it's the reopening after any pandemic or epidemic, the test of whether or not we should open. The controversy has been with whether or not we should open while the numbers are still going up, which of course Dr. Derry and I both agree from the science and public health, and most of us agree that it's not safe yet to fully reopen our society. If people are sick, or if people are dead, there is no economy. And most importantly, if people are afraid to go out because they're afraid they will become sick or die, you have no economy.
That's right.
That ended up being the bulk of our conversations earlier. There's so much that's happened. We have had, and I'm sure we'll get to it later, but there's been a double back. At one point, there was a conversation about not having any more White House task force meeting, and apparently that decision was changed. Someone thought that, oh wait, we still need these, which we absolutely agree with, because can we just be honest for a minute? Nothing has changed. This virus still has no vaccine. This virus still has no cure. We've had beacons of light, and I will say beacons. We've seen rays, but they lead back to a beacon that's way off in the distance, that we can possibly have a drug that might be able to mitigate or kill the virus. We possibly might have a mode or means to give artificial immunity through a vaccine. And they're trying so many different age-old remedies, age-old solutions, and even new ones. Monoclonal antibodies is something you'll hear about, where they're going to start actually trying to make them engineer something to elicit an antibody response to protect us. That's the only thing. The thing that can get us there the quickest, two things: putting on a mask, everybody staying inside, and having an artificial means like a vaccine to give us herd immunity. And Doc, I'll stop there. I don't want to do the whole show in 2 minutes, but we've been talking about this a lot today.
Yeah, we have. It's been a long day. So anyway, let's start with the numbers, and let's see where we go there. One thing that you can see, we are rapidly approaching 4 million cases. We add about 50 to 70,000 new cases globally every day. The number of deaths is approaching 300,000. We added about 3,000. We usually add about 3,000 to 5,000 deaths a day. The number of cases are, in terms of the daily global epi curve, is kind of staying more or less stable. There's a little bit of an uptick. You can see here. I think that's just a little hiccup at this point, but we'll see as the U.S. starts to increase the number of opening states that open, and as we start to see Brazil skyrocket, we're going to start seeing the same thing here in the U.S. As well. This graph here is looking at mortality. You can see what should have been a decline in the curve, and that didn't happen. We see that there's this uptick in death here. I think that these were within the margin of error, and this is why the folks didn't show this curve going down. I think it was very smart of them. I think that this is, again, we're going to start seeing increases in mortality as we're starting to see countries open up, especially here in the U.S. When you look at the U.S., we're about 1.2, rapidly approaching 1.3 million known cases. Number of deaths now approaching 73,000, and probably 73,000 today. We added about 6,500 new cases overnight, and about almost 600 cases overnight as well. Just to remind you guys, Vietnam War, we lost 58,000 soldiers and untold numbers of innocent civilians. We are rapidly approaching World War I. So we're at 73,000 cases. We're 116. I bet you we'll probably get there in about 3 weeks, 4 weeks or so, which is really tragic to say. Here we're seeing our cases. It looks like maybe this line is starting to come down. And I bet you if we had started and continued with our stay at home, I bet you this line would be coming down. But I have a feeling what's really going to happen is that this is going to just start picking up again. Again, we know that that's the case because it was admitted, and we'll talk about that in a second, by Texas Governor Greg Abbott, who admitted that opening up the state was going to lead to an increase in cases. Looking at the mortality for the U.S., again, we started to see what looked like a step down number of cases that kind of look like what's happening globally. But again, there's another, we had one of our highest rates of death happen just yesterday. So I think that we're going to start seeing more mortality happen, more people dying. Looking at our testing rates, we're at 23 million, we're 23,000 per million rates. You know what I'm going to do? So I'm going to add the number one country as well, just to give a reference. I think that's what I need to start doing as well. But this will give you an idea of the total number of positives. It's about 1 million. Total number of negatives that we've done in the U.S. is about 6 million. When you add them up, you got about 7.5 million. When you take the positive rates and divide it by this 7.5 million, this gives you your positivity rate, and it's about 14%. That means that we're still testing people that our pre-test probabilities are high, and we want that number to be less than 5%. When you look at our case rates, Louisiana is 1, 2, 3, 4, 5, 6, 7. We're number 8 in the country in terms of rates per million people, 6,432. When you look at our mortality rate, we are 454 per million people in terms of mortality. Excuse me, in testing, we are 1, 2, 3, 4, 5, 6 in the country in terms of testing. We certainly can do a lot better than that. This is our daily epi curve, which shows that the case rate is starting to is stabilizing. With the legislators in session right now, possibly arguing to overturn the governor's edict to order, stay-at-home order. We will see these numbers go up. COVID is here to stay, y'all. If you at all think that it's not, look at what's happening in our political system right here. Here we are seeing what looks like possibly a decline in cases. And that is kind of what we had always predicted, that it would take a couple of weeks to see a decline that would happen after we reach some sort of stable plateau here. So once we were here, the number of cases, the number of mortality was still going up. So while we were here, let's say, mortality, the epi curve was still kind of going up on this level, but now that we are starting to be stable here, right, we're starting to see a decline in cases. And so that's good news. Brazil is going up, as we suspect that it would. Number of deaths, 8,000. They recorded 8,000 deaths yesterday. Look at that. Look at that. Look at that. Holy cow. That is an enormous number of deaths just yesterday. Why? Because the president of Brazil is, he thinks it's a hoax. He calls it fake news. He blames the press and bad media coverage. If all of this sounds familiar, it should be, because people call President Bolsonaro the Trump of the tropics. And you can see a very similar approach to the Brazilian, the way that the U.S. is taking its approach with its decentralized, catch as catch can approach toward coronavirus. You can see Brazil is doing the same thing as well. When you look at the information is beautiful. You can see here these trajectories, infection trajectories. U.S. of course far outweighs everybody else, but at least we're not in that. We talked about last time we looked at this, we thought that maybe there was an inflection point here. Clearly, there is an inflection point, but I'll point out that Brazil is climbing. So we will see increases again happening with Brazil. These are some really interesting slides here, just basically showing increases in cases and stuff. But there's one slide, Dr. Riggs, I wanted your opinion on. This is a really fascinating slide. So what they did here is they created something called a stringency index, okay? How how strict was your government, right, in creating lockdown policies or stay-at-home policies, right? And they just created this index, and the U.S. is 71. So these numbers are made-up numbers; they're just based on what factors went into it. And you look at countries like South Africa with a 91, or Australia with a 71.3, Germany with a 78.97. And what they did is they were going to look at the total cases per million. So they were going to look at the case rates, right? And so when you look at the U.S., it has an index stringency of 71.58. Here you could see it's on this graph. On this y-axis is the index stringency index, and here on this y-axis it's the number of people. So you can see some really interesting correlations. So the UK and United States, fairly high stringency index, but not much in the form of a response. You see something like China that had a stringency index here, so they gave it a 66.42, but look how their cases fell, right? So it's just kind of interesting. Brazil has here, they're saying it has a stringency index of 70.52, but the cases are climbing. Here you can see Germany, when they hit their peak stringency index, you can see their cases fell. So it's just kind of an interesting way of looking at things. Look at South Africa has the highest stringency index, and you can see their cases are going up. So it's just interesting. It was just an interesting correlation that I thought was an interesting way of looking at data. Just to wrap things up, the big news of today was that the Texas governor, Greg Abbott, admitted on a private call with lawmakers that was leaked to the press that he was well aware that new cases of COVID would transmit and within society once he opened up his state again. Louisiana lawmakers are in the process of voting whether or not to suspend the governor's ability to declare a state of emergency. And then lastly, state officials block Florida medical examiners from releasing data on coronavirus deaths. And then lastly, we got the news of the day, the update. So any thoughts, Doc Griggs?
No, today's a very political day. We're going to have to plan for a lot of mixed bags. At this point, especially with the session being in, you're going to hear a lot of things taking place with regards to policy, folks. We've been in this we're going on our 9th week just with our coverage with the Coronavirus Corner. Doc, we've been 7 days a week doing this, and we've been living it with you in the community. My TV stays on, there's CNN, there's Fox 8, MSNBC. There's very little time to actually watch, but it's always playing in the background, listening to NPR in my car, listening to CNN, of course, listening to our podcast, Noise Filter. We're surrounded by it. And it's interesting. The really, really interesting phenomenon is watching how the different cycles, everyone comes to like actualization and acceptance of the current situation in their own time, not just as individuals, as healthcare professionals or non-healthcare professionals, but even as countries and cultures. Doc, you can really speak to that, because the reality is every time man has gone against nature, we've lost, and we will lose. That's just the cycle of things. There was a point that I made earlier that even this COVID-19 coronavirus that we're talking about doesn't have a name, doesn't care about its name, doesn't care about us as a human species. It has no biases. Once we get to a 70% herd immunity where it can't infect us anymore, it's not trying to kill us. It's just trying to get in and live off of us as a species and stick around, build a legacy of living in us. Once it does that, it's going to move on to another species. And we're not any more special than any other. We're just the only ones that are using artificial technology and non-common sense things to us to fight it. In nature, the fight or flight response is exactly that. If we know that there's something bad outside, as animals, we stay inside. Well, human beings, we're the only ones that we think we're smarter than nature. So we'll try to build something to fight it, and sometimes we're successful. But no matter what, we have a war that we're in the midst of rather than a battle. So be prepared to be battle weary, but we're ready for the war when you wake up again, because that's kind of where we all are, Doc. We have our flat moments, and it's coronavirus fatigue, but it's real, and it's not going anywhere because the virus isn't going anywhere. Doc?
Exactly right. This is the third lecture I gave today, and after the second one, I actually had to like just 10 minutes, and so was happy to do so. So if you guys are just tuning in, this is the COVID Daily Live Show with Doc Griggs and Dr. Derry. Thank you so much for tuning in. We do have a podcast that's available called Noise Filter. You can find more information at noisefiltershow.com. You can find it on the majority of the podcast catchers or podcast apps, wherever you get your podcasts. This week we started, so we're still trying to work out the some of the loose ends that are there, but thank you again for tuning in. The purpose of this show is to do some live question and answer. So if you guys do have any questions, please feel free to jot those questions down. We are happy to answer whatever questions you may have. Let me just jump out and go back to our stories. Just as Doc Griggs was saying at the top of the show, Trump contradicts his administration's plan to shut down the coronavirus task force. That task force, which was notably possibly doing good, I guess, minus the misinformation that comes from it, where they were contemplating possibly shutting down. Like Doc Griggs said, he reported that they're changing their mind on that, right?
Yep. Absolutely.
Anything more to add to that story?
Nope.
All right. A deep recession and ballooning unemployment in Europe darken the global economic picture. We are well aware that is going to definitively happen, and we are going to see something like that here in the U.S. As well. Doc?
Yeah, so that's, again, if you I'm becoming a student of infectious disease history, this is part of the normal cycle. Once people aren't able to work for pandemics, epidemics in large masses for any reason, the economy leads and then follows, leads and then follows. The economic solution has to follow the public health solution in order for things to turn around. So expect a lot of headlines like this, but don't become callous, but don't become depressed. And don't fall subject to clickbait. Doc?
This story, China assails the United States over Wuhan lab leak allegations. Again, I can't believe we have to do this, but I feel compelled to. Eric, what do we say about the fact that we have to report as medical journalists that the virus was not made in a lab? I can't believe I have to actually say those words, but I do, because there are those in this country that will continue to conspire to spread disinformation. If there ever was an example of fake news.
Yeah, so I can't say that I don't understand the why, though. Part of it has to do with what we were talking about earlier. It's the frustration and the COVID-19 fatigue. We still don't have answers, and we're not going to have answers for a while. So what happens when people have gaps in desired information? They make up answers on their own that seem to logically make sense. It just so happened that where the virus was discovered, it happened to be near a couple of labs, so maybe that was it. But no, we've talked about that before. We talked about it on a podcast, or at least when we were that we thought about, is that the fact that if it were engineered, the scientists are saying it would be much more dangerous and lethal than this. So this was not. We have local scientists, local experts that can give you the exact reason. This thing happens in nature, which is why Dr. Derry actually went into it. He had the job because he wanted to study infectious diseases. Things happen in other species all the time. This is called nature, and sometimes we get so caught up in being human beings, we forget that we're animals first. Yeah.
For sure. As the push to reopen the economy continues, a new report illustrates a fragmented federal response. There has been a horrific response with respect to how the centralized, coordinated response for COVID-19, and as you have different states that are going to open up differently. Again, they're going to open, and I think what's going to happen is that they're going to find that nobody wants to go out, or maybe people do go out and they all get sick. I don't know. I mean, I take you back to this. You have a governor here who's openly admitting, that they know that people are going to get sick. And the thing that frustrates me here is that it's not their people that's going to get sick. It's not his son. It's his wife. It's not his family, his parents, it's us, it's the working class. And that's the thing that's so difficult to think about that. Anyway, comparing recent deaths to historical figures hints at the real toll of each U.S. state. We do that with the, when I show you guys this graph every time, which is basically looking at, the historic mortality that this country has experienced in the past. Dr. Riggs?
This is, again, just it's kind of not water is wet news, but this is all stuff that we expect to see and will see. I was looking at the first one, illustrated fragmented federal response. It's kind of like what we already knew because we lived through it. This thing caught us way, way, way off guard. People didn't know how to talk to one another. And it looks like we're having to learn all the lessons that history's taught us all over again. If you look at the pandemic of 1918, they went through all of this before until they finally realized we all have to be on one accord. We have to have one language and do one thing. What do you mean? Well, we know the doctors back then were saying it's miasma, it's bad air. So everybody go inside and cover up. And guess what they did? They went inside and they covered it up. And basically what happened is, I'm going to use the terrible word, the term that we hate here in New Orleans to hear anyone say, and I give y'all permission to hate me for a day. We have to hunker down. We have to hunker down. They're already talking about hurricane season, what we're going to do with COVID, and I'm sure that'll come up as a topic soon. But the thing is, we have to do what we know that works. Evidence-based. Doc, you spent all that money, you spent all that time, and all that experience learning about diseases to realize that if nothing else, if something bad is outside, go in the house.
Right. There's something bad. Right. That is a good point. And moving forward, instead of stay the F at home, we should just be like, go in the house. Go in the house.
What's outside? It's a wolf. Have you seen it? Nope. But everybody that goes outside gets bitten. But guess what? I'm not going outside. It's a COVID wolf.
Does anybody have any questions for us? We would love to answer any questions that anybody may have. Otherwise, we're going to start wrapping things up here. Doc, do you have anything more to say? Or
get checked, get fit, get moving, wash your hands, and go in the house.
Stay the F home, wash your hands, wear a mask. Healthcare is a human right. We'll see you at the shop. We're going to film our podcast. Please sign up for our podcast. It's called
News Filter. It's on Spotify.
No, Noise Filter, not News
Filter. On Spotify.
That's what you get for trying to razz me, huh?
Long day, man. Long day.
All right. I'll see you later.